So to be helpful for you, we've developed a massage therapy equipment checklist, and we'll post it online for you to be able to have access to, and we'll have all those links up when we're done. Anyway, as far as an equipment checklist, I broke it down into parts that have to do with equipment you want to have for you personally, things that you need for the client, and then general equipment for your office, as well as paperwork and payment kind of equipment. So let's start with what you as a therapist needs. First of all, gowns or smocks or clothes so that you can wear a fresh, clean set for every client, because the client breathes on you during the session, so you will have the virus on that item. And if you wear an apron, but you still have part of your shirt exposed, that will still collect the virus. So if you do use an apron, also change your shirt and apron between clients as well. Clothes for the end of the day. After you've done your final clean, these are the clothes that you're going to wear at home so as not to contaminate your car and your home as well. And then shoes for the office, or you could disinfect your shoes when arriving or leaving the office as well, because you don't want to wear the same shoes that you wear out in public. First of all, two things. CDC does this as part of their putting on and taking off personal protective equipment in their procedures, and there's some evidence to support it, not a lot of evidence, but there's some evidence, but it's just simply good practice to follow. And then about shoes in general, it's sanitary best practices to wear shoes during a session. Bare feet, flip-flops, sandals, open-toed shoes aren't. Some therapists, though, just don't like to wear shoes, and we suggest that you start now, but obviously barefoot massage is a different case, and the feet must be sanitized with every client. So that's best practices for shoes and wearing shoes. I also want to talk about masks for a minute, because you'll need a mask as well. The only mask recommended at this point for close prolonged contact is an N95 or higher rated mask. And actually, it's not really a mask, they call it a respirator. But when people say wear masks, really best industry practice is that you wear an N95, because as I talked earlier, the virus is aerosolized, and this mask is the only one where the virus can't get around the edges of the mask. And given the numbers of frontline healthcare workers who have come down with the virus, even that's not a guarantee, but it's the best protection that's usually available to the public. A couple of other things that I want to say too is that there was some discussion on a local Facebook group around masks versus the N95. The idea was correct, but the article actually makes it more clear in terms of what kinds of masks protect who and so on. So for example, one of the things in that article that was referenced is that the FDA has not approved any type of surgical mask specifically for protection against COVID-19, but they do provide some protection. So if you can get your hands on a surgical mask and not an N95, you'll definitely want to use a surgical mask for you. But again, it's not going to be as effective at protecting you, because the N95 masks are about protecting both you and your client. And I'll talk more about them in just a second. Now, about the cloth masks is, again, that same article, which is out of Mayo Clinic, says that wearing a cloth mask will lose any value unless it's combined with frequent hand washing and social distancing. So basically what it's saying is cloth masks are effective when you're social distancing. And that implies that they're not if you're not social distancing. So if you're wearing, as a therapist, the cloth mask, you are not protecting either the client or yourself. And so that's industry best practices, again, is not the cloth mask as a therapist. Now, let me talk about the N95 masks for a minute, because I think it's important that you have some information on this, is that there's a wide variety of masks as well as manufacturers. And what you want to do is choose a mask that does not have a valve, because if you do, then you have to equip your client with one too, because what the valve does is that it allows one-way air, meaning that any infected air is not going to get into them inside the mask, so you're protected. But if the valve is there, all of your air, and if you do happen to be infected, will go out. And again, remember what we said earlier is that you need to assume that either you or your client could be infected. I mean, that's the assumption that we're working off of. So because the valve allows air out, you don't want to use that. It makes the mask a little bit more uncomfortable not to have that valve, but the best practice would be is that if your client is not wearing an N95 and they really shouldn't be because of the shortage of them, then you need to wear one without a valve. The other thing that you need to know too is that they do come in different sizes. So you must ensure that you're using the right size, because these masks do seal around your face, around the nose and mouth area, so that they need to be fitted properly. And then in order to get that seal in place, there's a specific procedure for putting it on and taking it off. So it's very important to educate yourself on that. There's a lot of YouTube videos out there that will teach you about that. So that's out there for you. So that's about masks for you. I'll talk about masks for the clients in a little bit, but best practice is N95 mask, and that's what's going to give you the most protection. A surgical mask is okay protection, but because air can get in around the edges of it, it's not as safe. Take that into consideration when you're choosing your equipment. As far as other equipment for you specifically, gloves for disinfecting purposes, and these are not like your latex or vinyl gloves that you'd wear during a session. This is for disinfecting purposes, and those can be skin irritating, so use a heavier duty kind of glove like you'd find in the kitchen, like when washing dishes and so on. Now, there are other OSHA guidelines for equipment to wear in phases 1 and 2, and so there's a little bit of controversy around them because, you know, I've been on the Facebook groups discussing what kind of equipment would be indicated for us, and basically what OSHA is saying is that people should wear head coverings, gloves, and face shields or goggles, and the question is, well, do we really need to? What I'm going to recommend is definitely for phase 1 and phase 2, and then when we get to phase 3, this will change again. So in phases 1 and 2, head coverings. The recommendation is yes, because if your head is close to their head, which is like when you're working on their neck and face, then yeah, it's a good idea to wear something on your head like a bandana or one of those little surgical things or whatever works for you, but to have your hair covered, because otherwise you're going to have it in your hair, and you'll need to be sure that you don't touch your hair for any reason, and then your client. Also, another recommendation is gloves for massage. The recommendation here is a toss-up, because the reality is for frontline workers, yeah, gloves are worn, latex or vinyl, gloves are worn for safety. But a lot of therapists are making very good arguments around not wearing gloves if you use very good hand washing techniques and you're careful not to touch your face. And a lot of therapists use forearm and elbows, which undercuts the purpose of gloves. And so again, if you're not wearing gloves, you've got to have good hand washing technique. And also, if you're using your forearm and elbows, you can't just give them a quick pass. You've got to really thoroughly scrub and wash your elbows and forearms as well as part of that. What is really important to take a look at is to have gloves around and wear them if you'd feel more comfortable wearing them, and also have some on hand if your client would feel more comfortable with you wearing them. Okay, so it's going to be a personal decision between you and your client, and making sure that you do good hygiene if you don't. A face shield or goggles, again, this is a toss-up, and again, not glasses, but eye protection. Again, if your client is not wearing a mask, and we do recommend they do, but if they're not wearing a mask and they sneeze or cough, you'll get it all over your face. And so that's one of the reasons why you might want to wear goggles or a face shield. And the same thing is again, if you're close to your client's face, working the neck and head, you will get the virus on your face, particularly if they're not wearing that mask. And so these items, a face shield or goggles or both, will protect you further. A face shield will protect the N95 mask a bit. Again, if you don't wear the face shield or goggles, it really necessitates sanitizing and washing around your face before removing the mask, because you want to be careful that you don't spread the virus, if it's on you, into your nose and mouth. So those are some things that you need as the therapist for your personal space and protection. Now, for the client, again, we do recommend a mask of any type. You're not protecting the client from the virus, nor are they protecting you. really, is what this comes from if you're having your client wear a mask. The point is to contain sneezes or coughs to minimize the spread. And so the order of protection really is an N95, which you're not going to give to your client because of the difficulty of working with them. The next level of mask for your client to wear could be a surgical mask, which would then protect them from any breath that you may have if you're only wearing a surgical mask. Also, the next layer down is a cloth mask with an approved lining, like a paper towel, a shop towel, or some kind of interfacing layer in there. And then the last level, which gives your client the least amount of protection, is a cloth mask. And again, it's not about protection. It really is about them wearing a mask is really about containing any aerosolizing, any spray from coughing or sneezing or spit. Because even though a client may be healthy, they do sneeze, they do cough periodically, and so we want to contain that. But even so, them wearing that cloth mask is not going to protect you from having an issue with catching the virus, because once it escapes around the mask and can be aerosolized in the air, and the only way to protect yourself more is to have that sealed N95 mask so it can't get into your respiratory system. The other thing is other equipment. There's a whole bunch of other equipment that I'm going to go through and just talk about them for a moment. Is the contactless thermometer, which meets the governor's requirement of taking, of checking symptoms, okay, for fever. And that's the only way you're going to be able to do that is through a thermometer. And we recommend a contactless one. But again, not everybody has a fever, so an optional piece of equipment might be a fingertip pulse oximeter, which catches those who might be asymptomatic with that low blood oxygen saturation. Those are the folks that are showing up with the blood clots and all those kinds of things who may be asymptomatic. So that fingertip pulse oximeter might be another way of looking at that. It just depends upon whether or not you want to go there. It's not required, it's optional. You also want to make everything impermeable, meaning that you want to have an impermeable table and face cradle cover if you're putting anything on your table, if you don't want to have that disinfectant eat up your vinyl. Okay, is that by putting an impermeable table and face cradle cover over them, it'll protect them a little bit, so like vinyl, but no cloth-like germicidal covers, because those germicidal cloth covers are breathable, which means the virus can penetrate under those levels, so it's got to be impermeable. And also, if you have a fleece face cradle cover or fleece on your table or some kind of padding or a table warmer, you can have all those on your table. You just need to make sure that it's underneath that impermeable cover. If, like I said, if you don't have items on the table, you might want one anyway, just to protect the table vinyl. Extra pillowcases. If you take a pillowcase and make a pocket by opening the pillowcase up, sticking it through the face cradle, and then putting the top edges around the face cradle, then putting the face cradle cover over it, that can create a bit of a barrier to catch sneezes and those kinds of things, because some clients may not like wearing a face mask when they're in the prone position, and this might be a way for you to help with their comfort, but also provide at least a little bit of protection from them spraying if they happen to sneeze or hopefully drool if we do a really good job with our relaxation sessions. But definitely when they're in the supine position, have them wear the mask. And what I recommend is that if you do this and they take off their mask, that they take off their mask when they're face down, and they put on their mask when they're face down before turning back over, okay? Again, everything's impermeable, so impermeable bolster and pillow covers, and again, not those germicidal ones. Impermeable chair covers, or get different chairs, because if you have a chair with cloth on it and they're sitting on that, there's not really any way that you can disinfect that. So either put a cover over it or use a different chair. It needs to be hard surfaced and non-porous. Blankets. We want to have enough blankets to use a fresh one for every single client, or consider raising the temperature of the room with a space heater, or turning up the thermostat, and then having blankets be optional. And then everything also needs to be secured and covered. So what that means is that you need to have some kind of enclosed space for your extra linens, towels, blankets, pillows, and bolsters that are not being used in a session, or sanitize the bolsters and pillows and those kinds of things in between sessions if they're out in the open and not in use, because everything needs to be sanitized and disinfected every single time. And everything is secured and covered. So Amanda talked about that lidded trash can with a foot pedal operation. You lining it with a trash bag for ease of disposal for the trash. You want to have secured covered storage for your dirty linens. You could potentially just buy a big garbage can that has a lid on it, just like that has a foot pedal on it that you might have out in your waiting room. Get another one of those and put them in your office space, and put a trash bag inside of that to line it, and then close the trash bag when you bring the lid back down. Any lidded container, as Amanda said, for putting tools in that have been used during the session that are going to be earmarked to be disinfected later. So that lidded container for that. You also want to have, for any other unused items, is having closed cabinets for that. And so overall, this means no open air cabinets or trash cans in the office at all, or in your studio or massage room, whatever your terminology is. With regards to lotion, cream, and oil containers and holsters. If you use a holster, because they tend to be fabric or canvas, you need one for each client in order to have best practice in terms of sanitation for every single client. If you have bottles, they need to be in either a lidded container of some sort, like by using a pump or a squirt bottle, and those definitely will be sanitized. Or if you have a cream that's in a big tub, you get it out for one client using sanitary procedures, and then you put it in a small disposable cup that's discarded after each client, including the lotion gets discarded. So you need to have cups for that, or if you use non-disposable, you need to have enough for each individual client, or be able to disinfect it between each of your clients. So enough of those to be able to do that. You need to have that clean space for your supplies that you're going to be used during the session, like Amanda talked about. Hand sanitizers, cleaning wipes, facial tissues, have them scattered throughout the office. So have enough for those. That EPA approved list-in cleaning products, that's also on your list as well, including the container for immersion. If you're going to be immersing your tools, you'll need a container for that as well. That's on your list. By the doorknobs to your treatment room, put facial tissues or no-touch paper towel dispenser so that you can use that for opening the doorknobs if your hands are not clean. And don't have an opportunity to wash your hands before you leave the room, because some treatment rooms do have sinks in them, others don't. Proper ventilation. So on your checklist for equipment, if you can't open the windows and you don't have an air purifier in there, you're looking at a 3-hour time frame. The virus can stay aerosolized for 3 hours. That's what some of the science is showing us. And we want to make sure that the air in that room gets turned over. We're also going to post a link to a consumer report about HEPA filter air purifiers and what to know about them. Some people are thinking they need to go to medical grade air purifiers, and that's not necessarily the case, but you want to just make sure that you have sufficient power to clear the room in the time that you want it to clear. So you may want to use one that's rated for a bigger room and put that in your treatment room. And then for the bathroom, if you have control over your bathroom, no-touch soap containers and paper towel dispensers, seat covers, and maybe a hand washing poster just for good measure. There's a place where you can print them off. We'll post that link as well. Now, as for intake, screening, and payment equipment, you might want to consider going paperless. You may want to do new intake, informed consent, or liability release forms. What you could do is simply add a new form specific to COVID-19 or integrate it into your current paperwork or your current system. Also, along with that is having some way of tracking symptoms for your regular clients. I walk into the doctor's office and they have a piece of paper that I sign every single time saying, has this changed? That's something that, in terms of having that paperwork or screening, everything on your computer. So, thinking about the intake and screening procedures. And then also payment processes. With regards to payment, you may want to consider getting a touchless way of accepting payment, because cash is discouraged typically because of how much bacteria and virus can be on cash. Same thing with credit cards or checks. Checks are a day. You might have envelopes if you have the person put the money into an envelope and then you collect that envelope that's clean. But having those card readers, touchless card readers, or putting a prepayment tab online so that they can prepay the session. So that's the basic equipment of things that you need to think about to help you get ready for seeing clients and having clients come in. Do you guys have any additions or any thoughts on that?
Just something that I'd seen at a gym. One of the things that they were actually thinking of doing was a sanitation station. So before a client comes in to sanitize their hands, or wherever that might be. So if you were to choose something outside of the door or outside of the building that you were on, just to have the supplies that maybe it's just additional supplies to what you said, or equipment. The other thing I would add is just making sure that you have enough of these items should you go back to work. So if you plan on using gloves, don't just have one set of gloves.
Right, so that you have enough for every client every time.
Yeah, I'd like to add, we have to imagine every client being our first client for the day. I mean, that's kind of another way to look at it. So with this client, oftentimes all these procedures and all these universal precautions we do with clients, we start our day with it. And then as we go on, we kind of lose touch with these procedures as we go through our day. With COVID, we have to really think about every single client is our first client, and making sure that all of the safety and sanitation and our equipment is disinfected and sanitized as if this is our very first client we're working on.